Most people over 60 who end up in the emergency room with a serious heart or circulation problem will tell you the exact same thing afterward. The signs were there for weeks, sometimes months. They were in their legs, a little swelling in the ankle here, some pain when walking there, one foot that always felt cold. And every single time they told themselves the same thing: that's just getting older. Here's what nobody told them. Those weren't aging. Those were warning signs. And today I'm going to show you 5 specific leg symptoms that could mean something far more serious is happening. And one of them, nearly 1 in 3 adults over 60 already has right now without knowing it. I want to be upfront with you. I'm not here to frighten you. I'm here to make sure you have the information your body may already be trying to give you. People our age have been through enough to know that catching something early is always better than waiting until there's no choice. So think of this as the conversation you'd have with a doctor who actually has time to sit down and explain things properly, which, honestly, doesn't happen nearly enough. Let's get into it. Before I show you symptom number 1, I need you to know 3 things. First, symptom number 4 on this list is the one that gets dismissed the most consistently, even by people who are careful about their health. I'll tell you exactly why that happens and why it's dangerous. Second, right after I cover all 5, I'm going to give you one specific question to ask your doctor at your very next visit. Most patients never think to ask it, but it could tell you everything about what's happening in your circulation. And third, I'm going to give you a simple self-check you can do tonight, at home, in under 2 minutes, that doctors actually use in clinical settings. That's all coming. But first, symptom number 1. Symptom number 1, persistent leg swelling, especially around the ankles and lower legs. Now I know exactly what most of you are thinking. My ankles swell when I'm on my feet all day. That's normal. And sometimes that's true. If you stand all day and the swelling disappears overnight, that's probably fine. But here is the question that changes everything. Does it come back every single day? Does it leave a dent when you press on it? Try this right now. Press your thumb into your ankle and hold for 5 seconds. If the indent stays, if your skin holds the shape of your thumb, that's called pitting edema. And when it shows up in both legs, it can be a sign that your heart isn't pumping the way it should. Here's what's actually happening inside your body. When the right side of your heart, the side that receives blood back from the body, starts to weaken, blood gets backed up in your veins. And because gravity always wins, it pools in your lower legs first. Fluid leaks out of those weakened veins into the surrounding tissue. That's the swelling you see. That's your body trying to tell you something. One critical red flag before we move on. If the swelling is in only one leg, not both, especially with warmth, redness, or pain, don't wait. That can mean a blood clot, and blood clots need immediate medical attention. That is not a watch it for a few days situation. Symptom number 2. This is the one I want you to pay very close attention to because it feels exactly like a muscle cramp. You walk a block or two, your calf starts aching. You stop, rest a minute, the pain eases completely. You start walking again and boom, there it is again. Most people decide they're just out of shape, so they walk less to avoid the pain. And that is one of the most understandable and most dangerous responses a person can have. That predictable cycle, pain when you walk, relief when you rest, has a clinical name. It's called intermittent claudication, and it is the hallmark sign of peripheral artery disease, or PAD. Here's what PAD actually is. Your arteries are narrowing from plaque buildup, the same plaque that builds up around your heart. When you walk, your leg muscles demand more oxygen. The narrowed arteries can't deliver enough. The muscles literally run out of oxygen and signal that with pain. You rest, demand drops, pain fades. You walk again, it returns. That cycle, every single time, in the same leg at roughly the same distance. That predictability is the signature. And here's why this matters far beyond your legs. The American Heart Association has found that people with peripheral artery disease have 4 to 5 times the risk of heart attack and stroke compared to people without it. Because if plaque is narrowing your leg arteries, it is almost certainly affecting your heart arteries too. That calf cramp is not a leg problem. It is a whole body warning sign. We are halfway through, and symptom number 4, the one I told you gets dismissed the most, is still ahead. So stay with me. If this kind of real, practical health information is useful to you, hit subscribe right now because next week I'm covering the blood sugar warning signs that show up in your feet before your glucose numbers even look abnormal. But right now, symptom number 3. Symptom number 3. I told you at the beginning that one of these would surprise you. This is the one. Cold feet, or more specifically, one foot that is noticeably colder than the other. Cold feet sound so harmless, so ordinary. You put on thicker socks and move on. But here's what's actually going on. When one foot is significantly colder than the other, it usually means that the artery carrying warm blood from your heart all the way down to that foot is partially blocked or narrowed. Less blood arriving means less warmth. It's as simple and as serious as that. A measurable temperature difference between your 2 feet is something doctors actually test for clinically. They call it temperature asymmetry. Vascular specialists look for it specifically when they suspect arterial disease. Here is a self-check you can do tonight, and this is the clinical version that doctors use, simplified. Before bed, take off your socks. Place both hands flat against the bottom of each foot at the same time. Not one after the other, both at once. You're feeling for a clear difference in temperature, not a slight variation. If one foot is clearly, noticeably colder, not just slightly different, that is worth writing down and bringing to your doctor. Do not ignore it and assume it'll go away. Without blood flow improving, it won't. Symptom number 4. I told you this is the one people dismiss most consistently, even people who consider themselves careful about their health. Here's why. This symptom is visible. You can see it on your own legs right now. And that's exactly why it gets ignored, because it appears so slowly that it becomes the new normal before anyone thinks to question it. We're talking about 3 specific changes to the skin on your lower legs. First, the skin becomes shiny, almost glossy looking, like the skin is stretched too tight. That happens because chronic poor circulation changes the tissue underneath. The skin and fat layers alter as the blood supply weakens over time. Second, leg hair disappears below the knee. Hair follicles need a steady blood supply to keep producing hair. When that supply is compromised for long enough, the follicles stop. If your lower legs have become noticeably smoother and you haven't been shaving them, that is not aging. That is a circulatory signal. Third, discoloration. A reddish-brown, rusty, or purple tint around the ankles and lower calves. This is called hemosiderin staining. It happens when red blood cells leak out of weakened, overloaded veins and break down under the skin. The iron from those cells stains the skin from the inside out. Here is my challenge to you. Right now, look at your lower legs the way a doctor would. Is the skin shiny? Is the leg hair gone below the knee? Is there any rusty discoloration near the ankle? Any one of those 3 things is worth mentioning. All 3 together means your circulatory system has been struggling for a while and has been leaving visible evidence the entire time. Symptom number 5 is the most serious one on this list. If this one applies to you, please do not wait. We're talking about 2 things together: numbness or tingling in the feet, combined with sores or wounds on your feet or lower legs that are not healing the way they should. Your body needs healthy blood flow to heal anything. Blood is what delivers oxygen, nutrients, and the white blood cells, the repair crew, to any area that's injured. When circulation is severely compromised, that repair crew can't get to the wound. So a small cut on your toe that should heal in a week is still open 3 weeks later. A blister on your heel turns into an open sore. And here is what makes this combination particularly dangerous. When poor circulation comes alongside nerve damage, a condition called neuropathy, You may not even feel how bad the wound has gotten. The pain signal that would normally tell you something is very wrong here is reduced or gone entirely. The wound worsens silently. This is most common in people managing diabetes alongside circulation problems, but it also happens with advanced peripheral artery disease and venous insufficiency without diabetes present at all. Non-healing wounds can lead to infections that reach the bone, and in serious cases, that progression, a small wound, no healing, infection, is how amputations happen, not from a sudden event, from a small problem that the body simply could not fix because the blood supply wasn't there. If you have a wound or sore on your foot or lower leg that is not healed in 2 weeks, that is a medical appointment this week, not next month, this week. We've covered all 5. Now here is exactly what to do, because knowledge without action is just worry. Step 1. Do the self-checks we talked about. Press your thumb into your ankle. Does it dent and hold? Sit down and feel both feet simultaneously. Is one clearly colder? Look at your lower legs right now. Shiny skin, missing hair, discoloration. Check any wounds or sores, healing normally or stuck open for more than 2 weeks. These checks take less than 2 minutes and cost nothing. Step 2. If any of those checks gave you a yes, call your doctor. You don't need the emergency room for most of these, but you do need to describe them specifically when you call. Don't say, "My legs have been bothering me." Say, "I have swelling in both ankles that comes back every day and leaves an indent when I press it." Or, "I get calf pain when I walk 2 blocks that stops when I rest." Specific descriptions get specific tests. Step 3, and this is the question I promised you at the beginning. At your next appointment, ask your doctor specifically, "Can we check my ankle brachial index?" It is a simple, completely painless test that takes about 15 minutes. It compares the blood pressure reading in your ankle to the blood pressure in your arm. If the ankle reading is lower, that signals blockage in the leg arteries. It is one of the most reliable early tests for peripheral artery disease, and most seniors never know to ask for it. You do now. Now, whether you have these symptoms or not, here is what you can start doing today that directly protects your leg circulation and your heart. Walking, 30 minutes a day. You don't have to do it all at once. 3 10-minute walks works just as well. Your calf muscles act as a second pump for your circulatory system. Every step squeezes blood back up toward your heart. It is the single most effective circulation tool that exists, and it's completely free. Elevate your legs when you sit or rest. Prop them up above the level of your heart for 15 to 20 minutes. Gravity starts working for you instead of against you. Stay well hydrated. When you're dehydrated, your blood thickens, and thicker blood is harder to pump through narrowed arteries. 6 to 8 glasses of water daily, unless your doctor has told you otherwise. And if you smoke, I'm not going to lecture you, but I will give you one specific fact. Smoking is the single biggest accelerator of arterial plaque and vascular narrowing that exists. Quitting, even later in life, produces measurable improvements in circulation, more than most medications do. Let's bring it all together, because these 5 symptoms deserve to be remembered. Number 1, swollen ankles, especially both legs, especially if pressing leaves a dent. Number 2, calf pain when walking that eases with rest, then returns when you walk again, every time, predictably. Number 3, one foot that is clearly R than the other. Number 4, shiny skin, missing leg hair below the knee, or rusty discoloration near the ankle. Number 5, numbness in the feet combined with a sore or wound that hasn't healed in 2 weeks. And the question to ask at your next appointment, ankle brachial index test. Write it down. I said at the beginning that the people who end up in the hospital always say the same thing afterward, that the signs were there for months. Now you know what those signs look like. That changes everything. One favor before you go. Share this video with someone over 60 you care about, a spouse, a sibling, a parent, a friend. That share could be the thing that gets them to the doctor before something serious happens. And if you found this useful, subscribe. I put out new senior health information every week in plain language, no confusion, no jargon. I'll see you in the next one. Take care of those legs.